Did you know that women in their 30s can experience premature menopause? Welcome to All Around Health Talk with your girl, Dr. Onyinye. As usual, this is a channel where our health is our priority. But before we go right into today's topic, I just want to say a very giant, big, humongous thank you to every one of you who has subscribed to my channel. We've hit the 1,000 subscribers mark and we're still growing. And I just want to appreciate every one of you that has taken time to watch my videos, subscribe and share the videos with other people. I'm very grateful. And I hope that you continue to seek more knowledge and that you continue to learn from this channel and share with your friends. I am committed to continue to make videos that will educate you and that will prepare you to make healthy life decisions. Thank you so much. I'm so grateful. So let's get right to today's topic. Now, today we're going to be talking about a topic that is every woman's nightmare. We're going to be talking about premature menopause. But before I give you all the details, do not forget to subscribe to my channel, put on your notifications so you get notified for every time I post a video. Now, just before we talk about premature menopause, we want to know what exactly is menopause. Now, menopause is a period in a woman's life where she begins to experience absence of her menstrual period or her menstrual cycle for 12 consecutive months. Now, this is a biologically natural process that occurs in every woman. It marks the end of a woman's reproductive life, and it generally occurs between the ages of 51 and 52 years of age. Now, what we're dealing with today is the fact that you could be in your 30s and have menopause. So, what exactly is premature menopause? Now, premature menopause is menopause that occurs in a woman before she's 40 years old, right? Now, this happens especially because the ovaries of this woman are no longer producing eggs or releasing eggs as usual. Okay, they're not releasing eggs regularly. That means she's not ovulating regularly, or she has stopped ovulating in some cases. And this is accompanied with the absence of reproductive hormones being produced by the ovaries, or they are no longer being produced the way they used to be produced. They are now being produced intermittently. So we're talking about estrogen, progesterone, testosterone, but mostly estrogen. So just for us to be clear, premature menopause occurs in a woman below the age of 40. She is not having her menstrual cycle as she should because ovaries have stopped producing eggs or have stopped releasing eggs or are not releasing eggs the way they should and have stopped producing estrogen or are no longer producing estrogen as they should. Now, premature menopause does not mean that a woman is aging prematurely. No, that has nothing to do with the ovaries. Premature menopause simply means that the woman's ovaries are no longer functioning as they should. What can cause premature menopause in women that are less than 40 years old? One of the first causes of premature menopause is genetic abnormalities. Now, genetic abnormalities that have to do with the XY chromosomes, such as the Fragile X syndrome, Turner syndrome, can cause premature menopause in women. Also, autoimmune diseases where your body produces antibodies that attacks your own tissues, including the tissues of your ovaries, can also cause premature menopause. We also have metabolic disorders that can cause premature menopause in women. Viral infections such as mumps can cause premature menopause in women. Also, we have cases of chemotherapy or radiotherapy, especially in women who have who have experienced one type of cancer or the other. And being exposed to chemotherapy or radiotherapy can also increase their chances of premature menopause. And also, surgically removing the ovaries for any reason can lead to premature menopause. And last but not the least, smoking. Smoking can cause women to have premature menopause. So what happens when a woman has premature menopause? So basically, the symptoms of premature menopause. Some women do not have any other symptom except the fact that their menstruation is now irregular or lighter. That's their only symptom. Other women will have infertility as a symptom. Obviously, this is because their ovary is no longer releasing eggs as it should, and so there's no egg to be fertilized to produce pregnancy. So infertility will also be one of the symptoms of premature menopause. However, because in premature menopause the ovaries are either not producing or releasing, they are still producing eggs, but they're not releasing eggs as they should. So a woman who has premature menopause can have a moment in her life where for some reason the ovaries begin to release eggs for a short period of time and then they stop releasing eggs again. But within that short space of time where the ovaries release egg, an egg could have been released that will get fertilized, and so a woman with premature menopause has a 5 to 10% chance of getting pregnant. It's a slim chance, but some women with premature menopause can get pregnant. especially if what I just explained happens. Now, so symptoms include lighter menstruation or irregular menstruation, infertility. A woman with premature menopause is going to have the actual symptoms of menopause, which include hot flashes, sweating at night, mood swings. She's also going to have symptoms of underlying conditions, maybe thyroiditis, vitiligo. If this is what is causing her premature menopause, then she'll have symptoms of those conditions. Her bone density will also be decreased because she's no longer producing estrogen, which helps with bone density. Also, she's going to experience vaginal atrophy, which is the walls of your vagina thinning out and becoming dry. Her sexual libido is going to be decreased. She might be depressed or anxious. So those are different symptoms that you might find in a woman with premature menopause. Now, how will your doctor get to the diagnosis of premature menopause? First of all, your doctor has to suspect it. So there has to be a suspicion. Why will your doctor suspect premature menopause in you? If you are having problems with fertility, if you're complaining of symptoms of actual menopause like hot flashes, night sweat, depression, mood swings. Also, your doctor will suspect it if you tell him that your period, you've missed your period for a long time, or that your periods have become irregular. So the first thing is the suspicion. If your doctor is suspicious based on your symptom, then he can go further to do certain tests that can confirm or discard the diagnosis. Now, after the suspicion, the next thing your doctor will do will be a pregnancy test. I know that might sound crazy to you. Why is he doing a pregnancy test? Because medically, the first reason why your period will stop, amenorrhea is the name, while your period will completely stop is if you are pregnant. So the first test a doctor will do is a pregnancy test just to discard the fact that you're pregnant. That's one. Then your doctor will do hormonal tests, right, to check the levels of your reproductive hormones, especially estrogen and FSH. Right now, FSH, follicle stimulating hormone, is the hormone that stimulates your reproductive organs to produce the reproductive hormones such as estrogen. So that is something that will be tested to see if the numbers are fine. Apart from that, if your doctor suspects that your premature menopause could be as a result of other conditions like vitiligo, thyroiditis, Addison's disease, he will do specific tests for those conditions. And obviously, your doctor is going to do a bone density test to see if your bone density is reduced, because one of the symptoms of premature menopause is reduced bone density, which can cause osteoporosis. And then he'll do genetic testing to make sure that you don't have any genetic mutations that could be causing your premature menopause. Now, after you've been diagnosed, what is the next step? Is treatment. Can premature menopause be treated? That must be your question by now. There is no actual treatment for premature menopause, like to turn it around, right? Like to get you from prematurely being menopause to now not being menopause. But there are ways to get around it. Number one will be hormonal therapy or the use of anticonceptives that contain estrogen and progesterone. This is because your body is no longer producing these hormones, and so you would need to take anticonceptives or do hormonal therapy that will provide your body with these hormones to help control the symptoms like the vaginal dryness, the mood swings, the bone density, decreased bone density, and all of that. So the anticonceptive is actually to help you manage the symptoms. All right. Now, if you have premature menopause and you desire to get pregnant, then the option will be in vitro fertilization, IVF. This means that you're going to get donor eggs because in this case, your ovaries are not releasing eggs, right? So you will need donor eggs. You will need somebody to donate their eggs to you. Now, these eggs will be fertilized with your husband's sperm in a lab. And once the fertilization has occurred, the embryo will be transplanted into your uterus to help it develop. Now, in this case, you would need to continue hormonal therapy to also help your uterus to support this embryo that has been transplanted into you. So that is basically the treatment options that are there for premature menopause. Now, the hormonal therapy, the anticonceptives will be given to the woman until she gets to the age of 51, which is the average age where natural menopause starts. Now, at the age of 51, your doctor will determine if you still need to continue with that hormonal therapy or not, right? So these are the options. Now, you might be asking, if our main problem is the fact that we don't have enough estrogen, why are we taking anticonceptives that have estrogen and progesterone? This is because excess exogenous estrogen, right? Exogenous means estrogen that your body is not producing, is coming externally. Increase in consumption of this external estrogen by your body can increase your chances of having uterine cancer. But progesterone will counteract that risk factor. So the idea is for you to take progesterone with your estrogen so that it prevents uterine cancer. So those are the treatment options, IVF or hormonal therapy. I hope this information has been eye-opening to you. Sometimes women, we think that, or human beings generally, because we're young, we think that we have enough time, but sometimes things like this happen and you could be in your 30s and experience premature menopause. So I hope this video has been enlightening to you, and I hope that you're willing to share this video with your friends so that they also get enlightened. Do not forget to give a thumbs up to show support. Leave a question or a comment in the comment section and I'll get right back to you. But most importantly, subscribe to this channel so that we can continue to grow more than 1,000 subscribers and we can continue to educate more and more people. Thank you for being here with me today. I'll see you in the next one. Bye-bye.